The program you are about to watch is underwritten by Allergan. The views expressed therein are solely those of the doctors. We get flooded with questions from our viewers and patients, and an increasing number of them are from men. And here's one right now. It's my son, Luke.
Hey, Luke.
Hi,
Luke. Hi, Luke. Welcome.
So my question is, as the son of a dermatologist, I realize that I'm in the very privileged scenario of having all of my questions answered immediately from my mom. Do you have any advice for people who may be a little bit embarrassed about asking their dermatologist about what's actually going on?
Before I rapid fire through us for great advice, I first have to preface it with Dr. Jeanine Downie's words of wisdom, which are...
I tell my patients, Dr. Google didn't go to medical school, but conveniently I did.
I love that.
So I tell them to look at the website. Look at my website, look at the doctor that you're interested in going to, look at the website, do some research, and that way you'll feel more comfortable with what the doctor offers before you even walk in the door, because they feel like they're out of their realm.
So the millennials are definitely an internet generation, and that's what they're going to do. But Doris, what's your advice other than that?
To let the doctor do a full assessment. Go in with an open mind about what you can have done and kind of go to your blue sky. What is it that you really want? What do you want to accomplish? And what are your real concerns? Just write down your questions if you're embarrassed to ask, and you can give it to them on a piece of paper.
So let's just back up for 1 second. If you're not going to the doctor, I think maybe Luke is asking, how do you get your advice? What's the smartest way to do it? Obviously, from the doctor's the best, but then what happens if you can't go to the doctor, Ava?
Well, I think that there is value to doing a little bit of research on some of the available procedures and kind of concerns that you have, whether it's specific to shaving issues or skin flaking. Something called seborrheic dermatitis is very common in men, flaking around the eyebrows, hairline. And so it's very useful to first identify what your issues are and then find a board-certified dermatologist who's compatible with your goals.
Can you tell when someone comes into your practice and is working up the courage to ask a question, potentially, that might have to do with their own vanity?
Yeah, well, 100%. I mean, but usually they have discussed it amongst themselves, and I noticed with the millennials, I think that you men you're discussing it a little bit more, right?
Yeah, I think so.
Yeah, I think so. And so oftentimes they'll come in and they'll bring a bodyguard, which is usually a female companion or a male companion who will, who might be the person to first ask the questions. Men have a really good way about doing that.
It's interesting because male vanity is something that we are all very experienced with now. That used to be absolutely forbidden, I think, for the patient as well as the doctor. Wasn't that comfortable? But we're actually very comfortable with men now asking questions, and I think that we have a lot to say in answer.
Right, exactly.
So how do you handle it, Jeanine?
I tell them that when they come in and they're concerned about how they look, I tell them it's their economic viability. Nobody wants to be the old guy at the workplace anymore, or for that matter, the old gal. And it's also romantic viability.
Absolutely.
So I explain that to them.
That's an important point,
because
too.
that interrupts their bottom line, depending on how they look.
And women want their men to look good. Men want their men to look good.
Right.
It's something that we all want our partners to feel good about themselves. They're happier people, probably.
But if they don't want to come to the office quite yet, I think that there are some basic things that all men can really do. And I think that they can start with, yes, in the morning, applying a mineral-based sunblock. That will give you a lot of years that you can preserve off of your face by not inducing so much pigmentation, redness, and wrinkles. And then also at night, washing your face, getting into the habit of washing your face. A lot of pollution, particulate matter in that pollution sits on your face. So if you can wash that off, that will also help not only with your skin health, but your bone health. And then using and getting into the habit of using a retinol. At least those 3 steps,
And don't forget retinol, use it cautiously. Ask your doctor about retinol. That's also always very important.
Of course. And then I would say go to your dermatologist early if you have acne, because I see a lot of men later in life when they can't afford laser treatments for their acne, regretting that they let it go too far because it may have been too vain to go see their dermatologist when they actually had active acne going on.
But where's that happy medium between the gruff guy who can go out for beers with the dudes and the guy who's doing too much? Is there too much?
I think there's too much with everything, even for women.
We obviously think this is meaningful in terms of protecting you, but it shouldn't be an obsession. It should be something you get through on a daily basis in order to be healthier. But the bottom line is we don't want you obsessing about it and spending your time doing that rather than something that's going to be more important in your lifetime.
And I would also add that men's appearance and how there's something called the facial feedback hypothesis, which is when you look in the mirror and you look good, you actually feel better. Absolutely. And so I think it's really important that men understand that as well. And so men are really joining the whole procession that women have started in terms of making these procedures acceptable and necessary for part of well-being.
Doris is bursting.
I think one of the things that I worry about is that men are kind of coming into a market that was mostly a female market, and they're being held to women's standards, right? So before it would be women go into the workforce and we're held to men's standards, but there is a market for men as a man where it's not about overdoing it or doing things that women do, and it's not about becoming feminized.
Right.
It's actually, if you choose to be, it's a very masculine look, and it's preserving your skin, your features in a masculine way. So we as dermatologists do approach it very differently for men and women, even if some of the ingredients and procedures and treatments are similar.
One of the things I say to my patients that I think is very healthy is that and it's not necessarily even beauty, or it's not vanity, it's health. If you take care of it, you let it go. If you take care of your face and you think your hair looks good and your beard has been shaven, and however a man feels he looks his best, and you do it in the morning and you take care of it, you let it go. If you don't take care of it, it's something that lingers and distracts you from your daily activity. So I think that's true for women too. If they get up in the morning and they put something on, they feel good, they wash their hair, they dry their hair, their makeup is right, they let it go. And so there's that issue of letting it go and getting on with the more intellectual pursuits or more, life-saving pursuits of work and happiness.
And then what I try to explain to a lot of males that come in the doors, and I try to reassure them, I have professional football players coming in to see me that want that endorsement, that want that injectable wrinkle reducer so they don't look so mean and so gruff right here. It's not, you can enhance the way you look without feeling like you're not you.
Or without looking like a woman.
Right,
Or,
exactly.
without
And so I tell
yeah.
them they're going to put their best face forward, and that there's nothing, there is something slightly vain about that, but I named my practice Image Dermatology because I want to help people with their image. I think that's really
The whole
important.
subject of vanity is also interesting and not necessarily bad.
Right, and I tell them I'm vain, so I'm good with it, and that kind of relaxes them, and that gets them
Exactly.
to kind of calm down. And then I do think all of us are susceptible for not having enough male-dominated magazines in our waiting room, so we need to do better with that, with
Yes.
welcoming
Yeah,
our
gender,
male
there's
patients.
no question gender is
Yeah.
becoming less and less of an issue.
Yeah.
So now let's hear from our glow-getter, Bart.
Hello, Digest Doctors. My name is Bart, and I am a freelance beauty writer and content creator. I am also turning 40 this summer, and as happy as I am with my skincare routine, I still struggle with enlarged pores in my T-zone. My question is, which formulas or ingredient combinations I should zoom in on that are geared towards skin types that lean more mature than millennial? I'm also not opposed to non-invasive in-office procedures such as lasers or peels. Thanks so much.
So here's that four-letter word again, P-O-R-E, that basically makes the hair on our arms stand up, because we know that there's not necessarily that much that we are going to do, but we are going to elevate the debris in that pore, and then we're going to refine that pore. I happen to love Intense Pulse Light for that. I think it really does a lot. I tend to love retinols because it actually speeds the exit of the debris from the pore.
I love those, and I would add in salicylic acid because it's a great exfoliator and it can get into the hair follicle and help exfoliate the skin cells that are lining that pore and help that come to the surface, which will make the surface sit better closer opposed. So while you're not changing the pore itself, you're making it appear smaller, and that's success. And it's available at the drugstore, so it's accessible.
Sabrina, I know you're a laser queen, so tell us.
So I do a lot of IPL in my practice, but I'd say for pores, I think adding a clear and brilliant to that IPL has really changed my practice and met the demand of a lot of patients that are coming in requesting that the appearance of their pores be minimized. Again, we can't get rid of pores, and things that claim to get rid of pores are false claims, but you can minimize their appearance.
And it's also important to know that when you're piling ingredients on, that pore is going to probably get clogged.
Right.
So, Jeanine?
I really like the non-ablative, resurfacing, fractional resurfacing, and I like the microneedling and radiofrequency devices, both of them a lot in terms of pore size. And then I explain to my patients, if you smoke or if you vape, your pores are going to be bigger. If you tan all the time, your pores are going to be bigger. So use sunscreen also.
So pores are a normal structure in the skin, of course. The size of the pore can vary. Can be bigger, can be smaller, depending on the weather, depending on how humid it is outside. And so using, sometimes people, like especially in the actor community, they use the pore strips. So that's a quick way to empty out those pores, and then they'll shrink. Yeah, don't overuse them, but then they'll shrink down.
So it's a great immediate result treatment that can be bought at the drugstore. So everyone is an individual, but genetics do play a role. Finding out what skin conditions and risk factors your family deals with is always helpful. Want to be part of our Derm Squad? Like and subscribe to The Gist.